Hello, my name is Kyla, and today we'll be discussing Crohn's disease. So, for my first slide, I just kind of wanted to go over what Crohn's disease is and what are the causes of Crohn's disease. So, Crohn's disease is a type of inflammatory bowel disease that causes swelling and irritation of the tissues, or also inflammation, other known as, in the digestive tract. Some of the histologic features of this disease include distortion of the crypts, which we'll also get more into, lymphocyte infiltration that I will also go into more detail about, and chronic inflammation of the rectum. So, what are crypts? Crypts are invaginations of the intestinal epithelium located at the base of the villi in the small intestine. These play a crucial role in intestinal regeneration and function. So, for lymphocyte infiltration, that is just the presence of lymphocytes or white blood cells within a tissue or organ, and it also often occurs in response to inflammation. Um, so when it comes to causes for Crohn's, there is no specific cause, but there is factors that they obviously feel go into that. One is genes. So over 200 different genes have been associated with Crohn's disease. I displayed some of them up there. And also your immune system. So there's a possibility that bacteria, viruses, and other environmental factors can trigger this. Why is because when the immune system attempts to fight off an invading um, microorganism or environmental trigger, an atypical immune response causes the immune system to attack the cells in the digestive tract as well. So what are the risk factors for Crohn's disease? First is family history. So people with a first degree relative, aka a parent, sibling, or a child that has Crohn's disease gives you a higher risk of being diagnosed with Crohn's disease as well. The next factor is age. So Crohn's disease can happen at any age, but it is more common in young children. So usually most people who are diagnosed with Crohn's disease are diagnosed before they're 30 years old. When it comes to ethnicity, white people, especially Eastern European people, have the highest risk. However, Crohn's disease is increasing among African Americans as well, located in North America and in the UK. So this disease is also being increasingly seen in the Middle Eastern population and among migrants in the US. Cigarette smoking is the most controllable risk factor in the development of Crohn's disease. With smoking, it can lead to more serious versions of the disease, and it can increase risk of having to get surgery down the road. Anti-inflammatory medicines, as they do not cause the disease, they can lead to inflammation of the bowel that makes the disease worse. So, for example, ibuprofen, naproxen, sodium, uh, diclofenac sodium, and other medications. So, what are the signs and symptoms? So some of the signs and symptoms are diarrhea, fever, fatigue, stomach pain and cramping, blood in the stool, reduced appetite and weight loss, and also pain or drainage around the anus area. This is due to inflammation from a tunnel into the skin called a fistula. Um, Crohn's disease can affect also any part of the small or large intestine. It can involve multiple segments or it can be continuous. Most commonly, it involves the last part of the small intestine. However, in some people, the disease is only in the colon or large intestine. Symptoms can range from mild to severe. Most times they develop gradually, but sometimes they can come suddenly and without warning. There's also some people go through a remission period as well, where this means that someone with Crohn's disease may have a period of time with no symptoms. Something I also want to point out as well is that some people experience symptoms outside of the intestinal tract. This can include inflammation of the skin, eyes, and joints, inflammation of the liver or bile ducts, kidney stones, iron deficiency, or delayed growth or sexual development in children. So, what are the levels and severity of Crohn's disease? So, there's three different levels. First, you have your mild to moderate Crohn's disease, which symptoms include diarrhea, abdominal pain. There's not really signs of dehydration, high fever, significant weight loss, or obstruction. The next level is moderate to severe Crohn's. This includes diarrhea, abdominal pain, abdominal tenderness, intermittent nausea or vomiting, significant weight loss, and moderate to severe active intestinal lining disease. And lastly, you have your severe Crohn's, which includes diarrhea, abdominal pain, abdominal tenderness, persistent vomiting, significant weight loss and marked muscle loss, fever. There's also evidence of intestinal obstruction, blockages, or abscences, um, which are localized infections of collections of pus, or severe intestinal lining disease. So, how do you diagnose Crohn's disease? There is no single test to diagnose Crohn's disease. Doctors will use a combination of tests um, to diagnose Crohn's disease, which include first blood test. Blood tests can check for signs of infection or anemia. They can also check for levels of inflammation, liver function, or the presence of inactive infections such as tuberculosis. Blood can also be screened for the presence of immunity against infections as well. The next test are stool studies. A stool sample may be used to test for blood or organisms which are infection is causing bacteria, to look for causes of diarrhea or other symptoms. Our next uh, tests are colonoscopies. They use a tiny camera on the end of a flexible tube to visually examine the entire colon and the very end of the ileum. During the procedure, small samples of tissue called a biopsy may be taken for laboratory analysis. This may help make a diagnosis. Clusters of inflammatory cells called granulomas may suggest a diagnosis of Crohn's disease. So that is something to look for during a colonoscopy. The next test is a CT scan. CT scan is a special X-ray technique that provides more detail than a standard X-ray does. So this test looks at the entire bowel as well as tissues outside of the bowel. An MRI scan uses a magnetic field and radio waves to create detailed images of organs and tissues. MRI uses a contrast fluid and is particularly useful for evaluating fistula around the anal area or the small intestine. And lastly, they use capsule endoscopy. This test involves swallowing a capsule with a camera in it. The camera pretty much takes a picture of the small intestine and sends it to a recorder worn on a belt. And the images are downloaded to a computer, displayed on a monitor, and they're checked for signs of Crohn's disease. So now we're going to look into the effect of Crohn's on an exercise response. So from the research I conducted, or looked into, engaging in moderate exercise, for example, yoga, walking, or cycling, has been seen to improve the quality of life without worsening their symptoms. Moderate exercise has a anti-inflammatory property that can help individuals with Crohn's disease. Um, with one of my resources, they conducted a study in 2014 that found that exercise can be beneficial for a person with Crohn's disease. Researchers also found that people with Crohn's disease who were in remission, that took part in high levels of exercise, were significantly less likely to have a flare-up after 6 months. So, management and medications. There's currently no cure for Crohn's disease. So the goal of treatment is to lower inflammation in the intestines, prevent flare-ups, and keep the client in remission. Although medications do not cure this disease, they do reduce inflammation and they bring on and maintain remission. So medications can include corticosteroids, which are a short-term steroid medication that you're not supposed to take long-term. Immunosuppressants, as azithromycin and methotrexate, And biologics include anti-TNF agents, IRAs, and IL inhibitors that they give out as well. So for my case study, I picked a 26-year-old female. For her medical history, she was diagnosed with Crohn's disease at 20 years old. She has currently been in remission and does light aerobic activity to keep herself active. She is currently on azithromycin and takes iron supplements due to her iron deficiency, which was caused from her Crohn's disease. Due to her Crohn's disease, she has also experienced um, fatigue and joint pain at times. Her goals are to build muscle strength, increase her aerobic endurance, and have an overall better quality of life while dealing with her Crohn's disease. So, since my client has been diagnosed with Crohn's disease and she struggles with iron deficiency, and also fatigue, I would recommend clearance before getting into exercise. So, for the test that I would have her do, first for the aerobic test, I would do the 6-minute walk test, which would measure her fatigue levels and her initial endurance levels as well. For the strength test, I would do a 5 RM bench press to assess upper body strength and 5 RM squat test to assess lower body strength. Why I picked 5 RM instead of 1 RM is because she does not do much strength training, if not at all. So to start her with a 1 RM might be too strenuous on her. So I felt the 5 RM was more appropriate. And for the flexibility test, I would conduct a sit and reach test to just get an overall where her flexibility is at. So for her exercise prescription, for her aerobic exercise, I did for frequency 3 to 5 days per week. For the intensity, I did a level 5 to 6 on RP scale, so very light, nothing too intense, and 50 to 60% of her heart rate reserve. Um, the timing, I would say about 30 minutes to begin, and types of aerobic exercise we could conduct would be walking, cycling, swimming, nothing too intense as stated. For resistance training, the frequency would be 2 to 3 days per week to begin. The intensity, we would keep it at 50 to 60% of her 1 RM, so nothing too intense. Um, I would have her start at 30 minutes per day. And types of exercise would include body weight, dumbbell, resistance bands, and barbell training. And lastly, for flexibility, the frequency for this, I would do 2 to 3 days per week. The intensity, the stretch should be held to the point of slight tension. For the time, we would hold stretches for 15 to 30 seconds, and the types of um, workouts would include yoga, dynamic, and static stretching. So when it comes to precautions and modifications, things that I noted were one, making sure to monitor her fatigue because she did have struggles with that, and adjust the routine accordingly to that. Keeping her hydrated is crucial, and anyone that is working out, hydration is key. Avoiding high intensity exercise in the beginning until she shows improvement and it's clear to do so. And if her flare-ups return, being sure to reduce the exercise intensity is a must. And also monitoring her iron levels, making sure they maintain proper nutrition, eat before exercising, just to make sure we don't have any issues with that. So in conclusion, I just hope this presentation gave more insight on what Crohn's disease is, knowing the signs and symptoms, how to go about beginning an exercise routine, and giving someone with Crohn's disease an overall better quality of life, and knowing that there is options despite having this disease. And down below are my references and resources. So yeah, thank you.